It's now up to you to decide where or when to mask up in public. The mandate was dropped in Ontario today for most public places, leaving us to evaluate our own personal risk. Joining us now to talk about what we should consider when deciding that is Dr. Sinha. Dr. Sinha, let's start with how you're feeling today with the dropped mask mandates.
I'll be honest, Dwight, I'm feeling a little bit nervous. I think a lot of my colleagues are as well, because we know that COVID is not over. The pandemic is still here. And we do know that with the decreasing of mask requirements, we're going to see more cases coming up over the next coming weeks.
So what sort of risk factors should people then weigh when deciding whether they should wear their mask or not?
The two biggest things are thinking about your own personal health and wellness and whether or not you're at increased risk of negative outcomes from COVID, such as if you're just an older person in general, whether you might be living with an immunocompromised situation because you're taking medications, or you may have a combination of illnesses that could weaken your immune system, or, for example, if you are a person who's not yet been vaccinated or not been eligible to get vaccinated yet. So these are the populations that need to think more about the value of them wearing a mask or wearing a mask to protect people in these situations as well.
You know, the vast majority of us here are vaccinated. So what happens if you've just got to make a quick trip to the grocery store for some milk? Is there still as much risk now if you aren't wearing a mask?
Yeah, there's more risk inherent, even though we think it's just a short visit, or, now I'm just going to a restaurant and, is it a big deal for me to wear a mask on my way into the restaurant, over to the table? Yeah, these things do matter. These things do add up, because while we think it's a quick thing, we think it's short, we don't anticipate those situations where we might be stopped by a friend, or we might have to talk to somebody else, and then you might be putting yourself or somebody else at risk. So myself and many of my colleagues, we're going to still wear our masks in those situations, especially over the next few weeks, when we know that after March break, we're probably going to see more COVID circulating in the community and an increased risk of catching the virus as well.
Yeah, you talk about March break. So, Dr. Sinha, what is your advice then for parents and children going to school or childcare with a big part of that cohort not able to be vaccinated?
Yeah, I would say that I would still consider wearing masks in these settings is a really helpful thing. It protects young children, especially under 5, who haven't yet been able to get vaccinated. It protects the healthcare workers the teachers and other folks around them. It just really is, it's a good practice to keep up, especially when we know a lot of people have been traveling. There's a lot of people have been interacting over the break period, and this is usually when we see a traditional rise in the number of cases amongst these populations in particular.
Yeah, lots of children will be coming back from international destinations for March break. Now, your institute, along with Ryerson, have created a tool to help us assess our risk as more restrictions lift. Can you tell us a little about that?
Yeah, we created a free online tool. It's been supported by the Public Health Agency of Canada. You can get it at covidvisitrisk.com or .ca. And it allows you to actually talk about a visit or gathering that you're planning in the coming weeks or today. In as short as 3 minutes, you just put in some factors about your own health, the health of those who you might be interacting with, what you're planning to do, how you're planning to get there. And it can help you evaluate how risky that situation is in terms of potentially getting COVID. And it really includes this whole issue about masks, so you can look at the situation, masks or no masks, and really help to understand the things that you can do to keep yourself and your loved ones safe over the coming months.
Dr. Sinha is the Director of Geriatrics at Sinha Health and the University Health Network, and leads health policy research at the National Institute of Aging. Thank you for joining us, Dr. Sinha.
Thanks for having me, Dwight.